A multinational team at APL-UW Center for Industrial and Medical Ultrasound is developing non-invasive surgical techniques based on boiling histotripsy, potentially a new way to treat benign and malignant tumors using high-intensity focused ultrasound, HIFU, to liquefy targeted tissue inside the body.
We're talking about high-intensity focused ultrasound. It's when ultrasound waves are focused from outside the human body inside to produce the desired bioeffect at the focus without affecting tissues on the path.
Current therapeutic HIFU systems focus an ultrasound beam through the skin to heat and cook targeted sites. Boiling histotripsy rose out of an attempt to improve HIFU.
We wanted to enhance HIFU treatments using nonlinear acoustic effects.
That led to an unexpected revelation.
This boiling histotripsy was indeed discovered by an accident. So we expected thermal damage of tissue, and instead we saw that tissue became liquid, which is quite unusual. It was really new.
So how does this occur? The research team believes the key lies in purposely distorting very high-amplitude ultrasound waves in a way that produces shock waves.
These shock waves are very efficient to heat tissue into boiling temperature in milliseconds within each pulse. And moreover, they are super focused, so the heated region is very small.
The heat generates a vapor bubble which grows, creating a cavity in the tissue. This cavity becomes a target for incoming pulses.
Then upcoming shocks from the remaining of the pulse, they interact with this vapor cavity, and this results in tissue emulsification or tissue liquefaction through acoustic atomization and acoustic microfountain mechanism.
We were puzzled what is the mechanism, and then we remembered that in all our demonstrations, when we wanted to attract students by physics, by ultrasound, we usually show them acoustical fountain. You have a jet, and then you cannot see it by naked eye. You just see the jet, and then suddenly you see some kind of steam around the jet. And this steam is cold, it's not hot steam.
The picture is dramatic. The process is complex. In thermal HIFU, power levels for thermal ablation are continuous and relatively low level. Boiling histotripsy is a very different story.
In boiling histotripsy, we are outputting very high power levels for a very short period of time. And so most of the traditional HIFU electronics and transducers that are used aren't capable of producing the type of pulses and type of power levels that are needed for boiling histotripsy. One of the things that we've been working on is producing these instruments.
The key instrument is the transducer, which transmits the ultrasound into the body. Key collaborators in this effort are based in Russia at Moscow State University.
We actively collaborate with this team from Moscow, which are renowned experts in nonlinear acoustics, numerical modeling, designing HIFU arrays for specific applications.
A lot of the design tools that Moscow State University has developed help us in designing transducers, as they're able to simulate different transducer geometries in different conditions prior to us trying to actually build and test a transducer.
It's still early days, but hopes for this technology are high.
Really, any application in which one needs to remove unwanted soft tissue or a collection of some kind of material from the body. The most obvious application is in oncology.
Researchers at the Center for Industrial and Medical Ultrasound continue to probe the methods and the mechanisms of boiling histotripsy, a promising non-invasive surgical technique using ultrasound.